Good evening, everyone. I hope you are okay. Sorry, it's a few minutes late starting this evening. If we can get through the next 45 minutes to an hour without any disturbances, it will be an absolute miracle. Just to explain, I've locked the dogs outside, the daughter's home, but we actually have an electrician at the moment, so he's kind of making a bit of noise around and about, but I will do my best to obviously make sure that you get the best out this evening as well. I've tried to find the quietest room in the house right now. So yes, this evening we're here to talk about BioRePeel. So BioRePeel is one of my favorite products. I am not here to sell it to you guys. That's not my job. I'm here to tell you how I use it, how I utilize it, and what, in what ways I use that in my clinical practice myself. And I think that means more to a lot of us actually, that it's not just somebody trying to sell a product. I know it does me when I'm looking at utilizing things in my clinic and in my practice as well. So I'm here because I get results, and I'm here because I want to share how I've got these results with you. So it's a bit of a case study approach, but of course I'm going to be talking about the product and what it's about as well, because that means a lot too. So without further ado, let's start our way through. So you're going to be here for about 45 minutes to an hour-ish, depends on how many questions that I have. I know there's quite a few that are logging in. What I will say, if you do have any questions, please pop them in the Q&A section for me, just so I don't get too distracted with everything else going on as well. And or if you want to have a chat amongst yourselves in the chat there, if you've got results, if you agree or disagree with anything that I'm saying, then that's great. Let's have a bit of banter and a bit of debate. That's always good as well. So the aims and objectives of today is to refresh, as always, on the anatomy of skin. I know, obviously, I'm probably telling you guys to suck eggs, teaching you guys to suck eggs, but it's so important that you understand the fundamentals of skin in order to get us the best result as well. Also, what is a chemical peel? So some of you might be logging on here, you might not already offer chemical peels, you might offer all the skin treatments, and why should I be offering chemical peels to my clients as well? The importance of combining professional treatments and home care, top tips for skin health as well. So at the end of this, hopefully you'll have content and things that you can put out there and share with colleagues and or patients as well. So please do share that you are doing this webinar this evening as well. That means a lot to us too. Home care and professional considerations, of course, so where to go to next. You're learning about one product, but there's actually lots and lots of other things to this product now that are coming out as well. So we'll be covering that as well. So you can pick up as much or as little as you want to along the way. So a little bit about myself. My background is actually dentistry. So yes, teeth, that is. But I actually now have my own skin and aesthetic clinic up in Derbyshire. So pictured here is Carsington Water. I don't know if anybody knows this way, in the Peak District in Derbyshire. So I still do dental treatments. My background is dental therapist, dental hygienist. I do them once a week at the moment. The rest of it is taken up by training and or the facial aesthetic side of things. My love for skin kind of came about a year after graduation from uni. I kind of, I love teeth and everything that there was to it, but there was other things that I wanted to help my clients with. And skin was one of them. So there I was. I'm actually now studying a cosmetic medicine master's, which is horrendous, but I am loving it all the same, because it is what I'm passionate about. So I'm not here because I know everything. Please don't think that in any way, shape or form. You may ask me questions that make me think, actually, I don't know, but I'll need to find out, and I will always find out, both for myself and for you guys as well. So please do keep in touch at the end of this as well. So there's just me, a little bit about my clinic. So we'll move on because I've already waffled through that enough. So it's great to be here. I'm honoured and privileged to be here as always, and I will obviously, go through this as quickly, but as accurate. Not even going to try and say that this evening, as best as I can throughout this evening, to make sure that you get the best out of it. Wow, it's going to be a good night when I can't even say that word. I'm not going to try again. Functions of normal skin. That's where we're going to start. The functions of normal skin, it's going to act, this is when it's healthy. Okay, so normal skin should act as a mechanical barrier. It's also a chemical barrier, and it's going to help prevent fluid loss. Something called transepidermal water loss can occur when the skin isn't functioning properly. And if we have the skin functioning in its correct manner, then we will minimize that loss of water as well. We're also going to defend against microorganisms, so we're not going to have bacteria and other organisms that can get underneath there and cause us a problem. Remember, this is skin that is functioning at 110%. Okay, so this is the normal skin and how it should be. It's not very often we see somebody with no problems with their skin whatsoever. So we're always going to find something that we can obviously work on them with. It's also its own endocrine organs. It's going to help produce vitamin D under UV, and that's what it will do under that stimulation. Melanin. Melanin is important when we're using any sort of peel, and we are going to touch on that this evening as well. So melanin is produced to protect against UV radiation. So UV radiation is what's going to get onto the skin, under the dermis, and cause problem to our DNA. The function of normal skin is also there for thermoregulation. So thermoregulation means that when we are hot, we obviously sweat. When we are cold, we shiver. So in consideration of, just bear with me 1 second. Sorry, I knew this would happen. Sorry about the distractions there, guys. So thermoregulation, when we are hot, we sweat. When we shiver, we are cold. And that's ultimately what our skin is in control of. So it works as a sensory organ as well. So we have that sensation from touch and feel. So we're going to start with skin, and I like to show you the diagram here so you can see it just spinning around, so you can really think about what and where we are applying these products. So with a chemical peel, we are applying it to the top part of the skin here, which is this part. What we are looking at doing is penetrating products underneath to get to this part. So this is the part that we need to protect. This is the part where we create our DNA. This is the part we need to look at. Well, we need to look after all of the skin, but ultimately this part in particular. So by applying a peel to this area here, we have that penetration that works its way through, and certain peels will penetrate in different ways depending on the pH of the peel, and the initial pH of the skin as well is certainly something to consider, and also obviously the condition of the skin. So if you imagine if we're putting acid onto broken skin already, if they have acne or a skin concern, then that peel is going to penetrate a lot faster. So patient selection is very important with any peel. We'll see on forums and posts that, BioRePeel is the peel for one and all. I would agree to that to some extent, but we shouldn't be peeling skin that is not in, okay condition to start with. And that is something that we should know about. If not, make sure that we educate ourselves more about in terms of skin conditions and things like that as well. So when we're applying a peel, we are reliant on it getting into the dermis to do what it needs to do. So BioRePeel is classed as a medical grade peel. It's a 35% TCA. A TCA is the type of acid that is creating these channels to allow the other products of the peel to get underneath the skin. It will all make sense when I show you these slides as we go along. But what I like about this is we can really picture what's happening. So peel goes onto this area here. We get that penetration through the epidermis. We create a transient gap for both the peel and the larger molecules of the peel to get down underneath this area here. So it is classed as a medium peel. There are obviously peels out there that you can have superficial, medium and deep, and BioRePeel is classed as a medium peel. Okie dokie, just bear with me. So why are we doing what we're doing? I'm going to start by playing this and waffling at the same time. Hopefully there's no sound. If there is, I'll mute it. Okay, so this was me talking over this. This is just a video that I found on YouTube. It's a really good way of explaining what's going on underneath the skin. So what you can see here is a fibroblast. A fibroblast is what creates collagen and elastin. So it creates that bounce to our skin, and it creates the structure and the function of the skin. As we age, you can see the collagen and elastin fibers on that last clip were starting to denature and break down. If we provide this fibroblast with what it needs, it's going to help generate new collagen, new elastin, and create that better quality skin underneath. So you will see products with fibroblast growth factors, And I would agree that BioRePeel is certainly one of those with the ingredients within it as well. Okay, so by creating this fibroblast fuel, you can see from the image here, these new robust fibroblasts are going to help create good collagen and good elastin. So a peel isn't the answer to everything, but it certainly is a really good place to start for our clients in terms of skin rejuvenation, aging prevention, and obviously helping with fine lines and wrinkles. But we need to manage expectations. That's important as well, because there may be other integrated treatments that we need to think about offering them alongside a peel. But it's certainly a great place to start. So top skin concerns, just bear with me, I'm going to have some water. Top skin concerns. For me, in my clinic, would you disagree or agree with any of these? Do you see any different? Please do chat away to me if you do. But predominantly, I'm just checking what everybody's saying. Okay, perfect. Yeah, predominantly we have pigmentation. We've got aging, obviously lines and wrinkles and or prevention of. We see a lot of clients with acne and skin tone concerns. So tone could mean the color of their skin, which may lie with obviously pigmentation, or it could mean when patients and clients are concerned about the elastin loss, or the tone of the skin, that turgor of the skin as well. They may have dry and irritated skin. And of course, we have clients that will attend with rosacea or acne rosacea and or a combination of all of those things together. So can BioRePeel help all of those? Yes, absolutely it can. But at what point we implement it is really important, especially when we come to the broken skin and skin of concern at that point as well. But that should be something that you would cover, obviously, if you go on to do the further training and things like that as well, and or you've got history and experience with peels too. So it's biostimulation. So the term biostimulation means it's biologically going to stimulate the skin and everything else going on underneath it because of what it contains in it. Advantages of this peel: we don't need a needle, only to draw it up before we actually apply the peel onto the skin. We aren't going to frost, so there will be no frosting, but never say never. I have used this peel and had frosting. The image that I shared today on the community, we did have some frosting, but we did it with microneedling. So remember what I've said about broken skin. If the skin is broken, this advantage of no frosting, we are going to get some frosting with this as well. And as we know, when we see that, that's when we need to stop the peel in action. It's painless. So the way I would describe this peel is a little bit like nettles. It kind of feels like it's tingling away and nettling away. But again, if we're doing this on broken or breached skin and skin that isn't ticking all the boxes like it did on the first slide, whose does, then, you know, we could say that there may be some slight discomfort with this peel, but nothing too much. It's very quick, so you leave the peel on 3 to 5 minutes, depending again on their skin type and how they feel about it as well, and the treatment concern that you are treating. We do have other protocols for different things when you become more experienced with it, and you'll see that in some of the forums as well, and or it should be covered on your training. It's multifunctional, so you can pretty much utilize it for all of what we've just been talking about: pigmentation, aging lines and wrinkles, acne, skin tone, dry irritated skin, and or rosacea. No post-treatment scars, and it's pretty much for all Fitzpatrick skin types as well. But we never say never. I've treated some really good cases of a higher Fitzpatrick with this peel. We've got them on good regimen, home care, and established a routine in the first place, because I don't want to just go straight in and start gung-ho with the peels. It's very important they understand the compliance that is required from them in terms of the SPF and the regular maintenance of the skin as well themselves. So the great news about this peel, TCA peels of the past used to have to be kept in the fridge. We do obviously when it's really warm weather, because obviously we don't want this peel to get too warm, but you don't tend to need to keep this in that cold chain fridge as soon as it arrives and or you've used it. So it's not going to oxidize, and we'll learn about how, what and why it doesn't oxidize. It's for ages 18 plus now, dependent on your personal indemnity and insurance. I do treat younger and young adults with this treatment as well. It is an amazing product for acne, and as a first peel, because whilst it's applying, we can actually touch and feel the face. It's actually quite nice for those that have never had a peel before either. Okay, so that's a nice long slide, but oh yeah, just to finish on this one, treatment. So you can use this before photostimulation, you can use it after radio frequency, and you can use it before topical treatment as well. So I use this pre-botulinum toxin, so pre-Botox, because the client feels the tightness from it pretty much straight away. So they think my Botox works straight away when it doesn't. It is actually the peel in action that's doing what it needs to do. So just some pictures here. This is just literally before and immediately after with the peel. I think from memory, we did this with dermaplaning. So again, that's another way that we can use this peel. If they've never had a peel, you're not going to go straight in with a dermaplane and a peel. Let's use our common sense. You're going to try them with the peel first, ultimately, hopefully with the home care in place first and foremost. But obviously by doing dermaplaning, you're removing more layers of the skin, and the vellus hair. We don't want to peel straight on top of that if they've never had a peel of sorts. So, and that, again, that's my professional opinion and from the clients that I've seen. So this two-phase technology, you'll hear this talked about quite a lot when it comes to BioRePeel. So it's got a lipophilic phase. And it's also got a hydrophilic phase. So what does that mean? So that lipophilic phase is a lipid layer that sits on top of the peel, both when it's in the bottle and both when it's on the skin. So remember that first slide where I talked about transepidermal water loss. If we've caused a controlled injury to the skin, we've removed all of our natural lipid layer, all of our oils. This is an oil soluble peel. It's going to work its way down. We need to replace something with that. So that's what the lipophilic phase will do. It will sit on the top layer of the skin and prevent that transepidermal water loss. So that's why with this peel, we do have some downtime. You will have some peeling, but the downtime is minimized because we're preventing that excessive moisture loss. So when you look at the bottle, you'll see a blue bit on top. That's your lipid layer. So if you imagine it like an emollient layer that's going to help prevent the moisture loss from underneath the skin. We've then got our hydrophilic phase. So this is the phase where it likes the moisture. So it needs to get down deep to do what it needs to do. This is the phase that's going to stimulate those fibroblasts that we saw on the video. It's going to activate this proliferation of biosynthetic processes. In English, we're going to get the collagen, the elastin, and everything kick-started and doing what it needs to do. We're going to wake up these free radicals. We're going to remove the free radicals with the antioxidants that we're placing underneath the skin as well. What's a free radical? A free radical is a cell that's not working as it should. It may have been damaged and or destroyed by, let's use an example of UV light. What that free radical will do is go around destroying other cells because it will pinch things off it. So it tries to make itself better. So that's why free radicals, we need to use something like antioxidants to help eliminate them, both eat them and use them in our skincare as well. But this peel is full of free radical scavengers and these antioxidants that are going to do just that. The keratolytic and peeling action. So we've got the TCA, the peel that's going to work its way down, this acid that's going to work its way down. What we're going to be doing is encouraging that faster skin cell turnover. So the natural skin cell turnover for most people, up to about the age of about 55 is around about 28 days. It does get a little bit slower. But what we're doing is encouraging a regular skin cell turnover with the likes of chemical peels as well. What I would suggest, if you're treating something like acne and large pores and or comedones, you will hit BioRePeel hard with an acute course. So you'll have, say, 3 or 4 in a row, up to 6, and then have your maintenance that comes along after that as well. So if you imagine, if we're using this for acne, we need that product to keep going on the skin and in the skin to help with that bacteriostatic activity. So it's very important we understand the condition that's presenting to us and how we can utilize this product to the best advantage. Okay. So this is part of a radiofrequency facial that I offer. So you can see this is one session. So this is one of my most popular treatments. I call it the Derbyshire facial. A little bit cheesy, but it does what it says on the tin. It's where we are. And ultimately, this is after one session. So really, really impressive. And client reports that plumping efficacy and the tightness of the skin and it feeling very, very nice. So let's have a little look at the ingredients and what's in here. So this makes a bit more sense now. You can see the lipophilic phase and the hydrophilic phase. Hydrophilic means it likes moisture, it likes water, and it's going to take on moisture for the area as well. So face, neck and décolleté. You have a 6 ml vial. So in a pack, you buy 5-6 ml vials, and really we should be using around 2 ml per face per treatment. So you're going to get about 3 to 4 treatments out of one vial, dependent on the size of the face. In terms of the acid, you've got your TCA acid, your trichloric acid, that is the transporter ultimately. So this is the one that's going to make all those gaps within the skin. It's going to break down the keratin that holds our keratinocytes together and allow these other things that are quite large and can't do that on their own to get through. So this is the good stuff that's making the path for all of these to get through. Hopefully that makes a bit of sense. So we've got a lactobionic acid, we have our salicylic acid. So an important thing to consider with BioRePeel is anybody with an aspirin allergy, you would probably want to avoid and or pick another peel for them. Tartaric acid and your citric acid, they are your skin lighteners, they're antioxidant, they're going to be really, really good for the skin and help with the lightening process of any pigmentation as well. Your glycine, your proline, your hydroxyproline and your arginine, they are key amino acids to wake up those fibroblasts. Remember that slide that I showed, the video that I showed you with the fibroblasts that makes the collagen, the elastin? The glycine, proline, hydroxyproline, and arginine are amazing fuel for that. So that's why we need to get that in there. Your vitamin C is your optimum free radical scavenger. So it's going to go in and take away those free radicals and the toxins. Now your gamma amino is amazing at tightening the skin. So it's kind of like a topical Botox. So it's going to go in and it's going to calm the muscle down. It's not going to stop the muscle from working like a toxin will, but it's going to calm the muscle down. Your squalene and your isoprime, if I can't even say what I've tried to say earlier, I'm not going to, let's call it isopril. So what that acts as an emollient to the peel as well. So that will sit on top of the skin and prevent that transepidermal water loss. Okay, you have to excuse me, it's been a very long day. And it's only Monday, so just how am I going to get through the rest of the week? So we shake this bottle, we shake it to wake it up, and then we apply it to the skin. So there is a video that you will see obviously on your training or anything like that, or you might already be doing this, which is great. You shake it all up together and it does what it needs to do. And you need to shake it each and every time. So this is a case that I did. I implemented BioRePeel with microneedling. You can't quite see the end picture, that's a shame. I've cut it off with a banner there, but you can see this pitted scarring pretty much gone. Even this is just one session. This is after 2 sessions, so really, really impressive. I actually needle the product into the skin. Then there are protocols for that. I wouldn't recommend it when you're first starting out. Let's start off with the basics, with the fundamentals and the foundations. And I didn't just go in and do that on that lady. We start off with home care compliance. We're obviously going to prevent any further spots from coming before we do any sort of needling for scar work as well. But BioRePeel is incredible for scars, really, really good. So products available, I talked about this earlier, and I think there are some more to add on. I'm not sure if I've added them onto another slide. So you've got your BioRePeel face, neck and décolleté. You've got your BioRehydra, which you can use after the treatment, and the relift that they can have at home. And we obviously do them in the professional sizes as well. So do I utilize all of these? If I said yes, I would be lying. So there are all other things that I utilize alongside BioRePeel, and it's down to you to use what you are getting results with. I have used this and had results, and I've used other things and had results as well. But ultimately, the peel system does everything that it needs to do. But it's always good if you can complement it with those treatments and those products that have been made to work alongside. Where we're going to start, we're going to start with prevention. So prevention is key. So that's why I've been talking about the home care and things that you are going to implement first and foremost. And you're going to do that with skincare, with home care, ensuring that they are wearing their SPF. So we should not be offering peels or doing peels on anybody unless they're using an SPF on a daily basis. And that is so important to really, really stress to them. What is the point on them investing in acute peel procedures and then regular maintenance from peels if they haven't even got the fundamentals in place? Really, really important. Remember the pore minimizing that we talked about? this is going to come from this peel as well. So this is a case of mine that I did. Again, we did a course of peels and then we did microneedling on top afterwards, a few sessions to get these results. So it doesn't happen overnight. You've got to get patient compliance. You've got to keep the patient on board as well and ensure that they are engaged with it. Just bear with me 1 second. I'm just going to tell these guys next door to be quiet. I said this would happen. Okay, so as you can see here, we had some really, really nice results from this pore minimizing. So this is microneedling alongside the peel at the same time. And this is another wow one that we did. So this was a acne case. So they'd obviously got on top of the acne previously. They'd come to see me for skin conditioning. And then we really hit things hard to get some really nice results with our microneedling device. This is my sister-in-law, so we've helped treat pigmentation on her skin. It was a great moment when she texted me one Saturday morning a picture of the pigment that had actually just fallen off her face, and this was this area here. Again, very, very rewarding, but time consuming, so we have to work our way up to it and ensure that the patient is engaged and on board with it, that it's not going to happen overnight. That's really important to note. So treatment options, we're always going to start with preliminary skincare. We are going to talk to them about aftercare and downtime, and that's important. So with BioRePeel, they do get flaky and peely a little bit afterwards. It's usually about day 3. It depends if you've needled with it or you've just done it as a peel procedure. I haven't shown it yet, but there is a pre-peel option with BioRePeel, and that's called the Forever. So you might see that a little bit more. Again, it's probably, something for another webinar that we need to, and then I know Sarah's done webinars on this already, so you can probably backtrack on those. But if you imagine with BioRePeel, it's an exfoliation process. It's a professional exfoliation. That's what I tell my clients. What you can do on skin that is in good condition or better condition is, potentially do that pre-exfoliation with dermaplaning and or something like Forever, which is like your old school microdermabrasion with the gritty paste that's going to help remove dead skin, preliminary for that as well. Prevention, obviously, if they've come with pigmentation, work out how, what and why that's happened in the first place. It's probably because they have little or no skin regimen. So it's important we help get on top of that in the first place. Otherwise, it's pointless as doing any treatment and or them investing any time on their skin and their procedures themselves. Those of you that don't know me, I am an ambassador for the skin charity, and no matter what webinar I do, I always throw this in, make it relevant, of course, but we are working with the skin. It's super important that we know how to recognize early onset skin cancer and melanoma. So pigmentation, we're seeing these clients that are coming through with skin concerns. You're not there to diagnose it. You are there to basically spot something and have that conversation with the patient and the client. You can do this. There's an online accreditation with these guys. So give them a follow and just look it up for me. That's all I ask you to do. If you've got any questions about it, do reach out to me as well. Amazing little tool and a resource, and it's about £20 to do it. No excuses. But we do have a webinar in a few weeks on behalf of Shop Beautiful to talk all about this. So keep an eye out for that on the webinar list as well. And that will be a little of me attempting to say words again at this time of night. So I do hope you having, I knew I'd put it on somewhere, so I do want to talk about it. So BioRePeel, hopefully you know a little bit more about it now. There is training available. If you have no peel training, I would advise you get peel training and then you learn this product as a brand. Ensure you won't get insurance, or you will struggle to get good quality insurance if you just do online training for peels. That's my advice to you as a professional. This was the Forever Universal Pre-Treatment Kit that I was trying to explain. So you can use this BioRePeel, and it's really good actually. It's a bit fussy when you first start using it, not going to lie. You get the black stuff everywhere and the bees annoy you because you can't get them all off. But when you get used to using it, you can use this alongside BioRePeel, and they will peel a lot more, so that it will increase their downtime. But obviously what we know, if we are really trying to hit pigmentation hard and or skin concerns hard, then the more peeling the better in certain circumstances. So this is a really good little tool to have. And you can then think about offering different versions of BioRePeel. So you could have it with dermaplane, you can have it with microneedling, you can have it with this, or you can have it on its own. So you can actually create a price list and a treatment list on its own just from one peel. So that's a pretty good thing to do. I do hope, I'm sorry about the distractions. I'm sorry if you could hear the murmur in the background. I knew it would be like this at this sort of time. I apologize for that, but I do hope you've taken from today what you needed to with regards to BioRePeel. I have seen some questions pop in, so I'm just going to have a little look at those and see what they are. What is the protocol for men if they want to do face, neck and décolleté? When is the best time to shave? I would say to shave on the evening of, thank you for the feedback on the background noise saying it was fine. I'm glad it wasn't too bad. What is the protocol for men if they want to do face, neck and décolleté? So yeah, I would get them shaved the night before. It may be quite tender if they shave the day of, but BioRePeel is incredible for follicular acne and or those who, you know, gents that shave all the time and they get the spots that come up. So the follicular acne, really, really good treatment to offer them. It's also quite a manly peel as well. I know it sounds a bit sexist, but it comes in a green bottle and it's very, very good, you know, to get gents on board with peeling as well. So yeah, that was a good question. I'm not sure why you couldn't hear anything, Alison. It may have been the sound on your end, I'm afraid, because I can't see any other messages about sound, but there will be a replay of this hopefully available within the next few days. So please do check that out. Let me just have a little look at some of these questions from the beginning then. So what is the pre-care we should be giving to clients before their appointment? So pre-care is have some sort of regimen. So we're applying an acid to the skin, okay? And this is what I will always say to a patient. They've come, they want a chemical peel. That's great. We can do that with you, no problem. However, the pH of the skin that you have right now in front of me should be around about 4.5, 5.5. Okay. If you've used nothing but soap and water on that for the last goodness knows how long, and you've got poor skin regimen, the pH is probably either very alkaline and or quite acidic. So it's one of these, usually alkaline. If we think of soap, that sits around about 7 or 8. So if that's all that they've been using on their skin, the skin is going to be quite alkaline. So to apply a peel to it, it's you know, it's not going to give us the best results. So get them in front of a good skin regimen first and foremost. So a cleanser, you know, some sort of serums and toners, you know, whatever it is that you have that you can offer to them that you could get them on board with. So people ask me all the time, oh, what skincare product shall I use? Skincare products that they're going to keep buying, that they're going to maintain and use, and they're going to follow all the steps from are the best ones to offer and to actually sell. Shop Beautiful, loads of different various ranges that you can obviously look through. I would always try and, you know, say to stick with one brand and try not to mix your brands, even though I do have clients that have done and do that, and they've had really good results as well. But prevention, SPF, good quality cleanser, they're your two things. If you're going to upsell anything, first appointment, SPF and your cleanser, that's my advice. Michelle, you've said you see quite a lot of scarring. So yeah, scarring, this product is good for scarring, but we need to manage expectations and we need to utilize it with other integrated options, like your microneedling, even your laser and your radio frequency, just to help with the skin and the recondition of the skin as well. Deborah, can I just go over that, please? As soon as we get frosting, take it off. Any broken skin? Yeah, so what frosting is, Deborah, and those of you probably already know this, but frosting is where the keratin that holds the skin cells together has come to the surface too quick and oxidized. So it means that the peel's acting quite fast in that area, and I would always advise to just stop it localized if you need to, but just stop it in those areas. And you will predominantly find it's where you have broken skin and or if you're needling with the product and it's had, you know, the skin's had too much. It's a sign for me, in my professional opinion, that we need to take this off. Okay, let me just work our way through. No, couldn't hear anything in the background. That's good. How many sessions maximum and how long do I need to leave between the peel and the treatment? So how many sessions maximum? So we say no more than 6 in a row. So what I do if I'm treating acutely, so patient walks in with acne or pigmentation, I say, right, minimum of 6 peels 1 week apart or 7 to 10 days apart. Then we review. At that point, we'll then review, and then we'll have a look and make a plan if there are other treatments that we need to plan in and or integrate BioRePeel in a different way. That would be my advice to you. What is the protocol for rosacea treatment, please? There is no set protocol for rosacea. Remember, rosacea is a medically diagnosed condition, and it's very important we don't tell a client that's what they have. We can say it looks and it signposts to that. For an official diagnosis, I would signpost you to your GP or dermatologist. However, what I can see is you have large pores, the skin is red in this area, it's quite dehydrated, and I can help with all of those things. So that's my advice as to how you would talk that through with them. And where we start, Julia, is we start with prevention and home care. More often than not, the reason somebody has rosacea is because that lipid barrier is breached. So really throwing a peel onto it that very first time is not ideal. Get them using and trying to get that pH of the skin to where it needs to be. Whenever I use, all my clients do feel tingly and skin does dry and flake. Also, some areas do have frosting. Yes, Azra, as we know, each skin type that we apply this peel to is going to have a different reaction. It's important we prepare our clients for potential reactions. It's going to feel warm. It's going to feel tingly. You know what? It can feel warmer when we take it off as well. We tell them all of this. We have applied acid to the skin. So this drying and flaking of the skin, if a skin needs to peel, it is going to peel. If they have poor regimen and they have poor skin condition, they're potentially going to peel that a little bit more as well. Okay. And any areas of frosting, I would advise that we stop the peel straight away in that area. Can we treat while our client is having laser, and if we can, pre and post time? Also, can they have hair removal, threading, waxing, shaving? So general protocol with peels is that we are not peeling around any other facial hair removal, laser, anything like that within the last 2 weeks. That's my personal opinion on it. And obviously, waxing probably a week you could get away with, but you're applying acid to a skin. You don't want to apply acid, especially 35% TCA acid, to skin that has been ripped off or treated in some way. So think of it like that. Rebecca, where am I doing my master's in cosmetic medicine? I'm doing that with the University of South Wales, Rebecca, so you can have a little look into that if you wanted to. Can we use BioRePeel on acne? I've seen active acne as one of the contraindications. Okay, really good question, Helena. We can use BioRePeel on acne. It's amazing at getting in underneath the dermis and acting as that bacteriostatic element. So it's going to help reduce the amount of bacteria. It's oil soluble, so it's going to help break down the amount of oil, and it's going to help control and regulate the oil that's produced. That's why it's a great peel. However, I would apply it onto acneic skin, but not on the sebaceous boils or the spots that are coming through. So you'd apply it in other areas. If you apply it to actual spots and or broken skin, you're going to get that frosting. It's going to be quite sore for the client as well. So get it on, but get it around those areas is my advice. And obviously cross-infection, being mindful and just explain to the patient that, that they may have a little more discomfort. I have a degree in beauty therapy and I'm trained in microneedling. As a non-medic, can I provide this peel? Yes, Michelle, this peel is readily available to you as long as it is insured, covered by your insurance. You would have to tell them it's a medium peel, a medium TCA 35% peel. There were issues in the beginning, but this has now been resolved. So I've been told by the guys at Shop Beautiful. Okay. Can you send me a copy of the slides with the products available? Francesca, if you want to email, feel free, then you can do that. Other than that, if you just type in CMed Aesthetics and or BioRePeel, it will all come up on the Shop Beautiful website for you. Is Forever Repeal an alternative for dermaplaning or microneedling? Yes, it is. Or you can do all of the above. So you can offer it out. Obviously, we're looking at the skin condition. This is what I stress to everybody. So you're not going to go in all gung-ho with all of that the first time you see someone. And I'm not saying that you are, but it's very important that we look at the skin condition. And yeah, absolutely, you can address that as a luxury dermaplaning option for that client if you're doing the Forever before with the dermaplaning and the BioRePeel as well. I do that quite often. It's a nice little treat. That's what I like to have on my skin. Can you combine with microdermabrasion? I wouldn't know the answer to that directly, but what I do know is that I would suggest to use with the Forever system that you do pre for it as well, before it. Getting good results if you use chemical peels alone? Yes, you do. It's very lightening and brightening. It's going to tighten the skin. It's going to help with the fine lines and wrinkles as well. Can I do BioRePeel on any type of colour of skin? Yes, you can, but obviously we're looking at the skin condition first and foremost. We are anybody who has that increased risk of post-inflammatory hyperpigmentation from the likes of a higher Fitzpatrick skin type, keloid scarring, all of these things we need to bear in mind. Preliminary skincare, enzyme, what's the word? Gone out of my head. This would happen because of all these questions you've done me in. Tyronase inhibitor, that's what I'm trying to think of. So the enzyme that is produced when our skin is creating that pigment, with those of a higher Fitzpatrick skin type, we should be looking for tyronase inhibitors, and vitamin C is one, so your antioxidant and vitamin C will help brighten the skin as well. How long is the pre-care regimen before you actually perform the peel? So I would always advise anybody that's coming for a peel with me to just get them using some home care products for at least 7 to 10 days pre-treatment. So it's improving their skin condition. There is no set time, Gemmalyn, but that's what I would advise. And I think I answered the how many sessions one. I've answered that one already. Just going to check the chat, make sure there's no more. If I do just treat 2 treatments, can I see any results? It depends on the skin that you're addressing in the first and foremost, of course, and it depends on your home regimen as well. How to combine with radiofrequency? So you can do it after radiofrequency, and you would obviously, I would advise to speak with your radiofrequency provider, supplier, and talk to them about how you want to integrate this treatment, and of course your insurance as well. How many days IPL can be done after peel, please? So IPL is obviously going to excite our melanocytes, and it's a light procedure. So I would seriously recommend around 2 to 3 weeks afterwards, because we don't want that pigmentation to get worse from treatments like this as well. I've used Forever before, and she's put the BioRePeel every day. What's this? Hang on. I've used Forever before too, and she's put the BioRePeel every day. Yeah, so using those procedures, those products after your treatment, you're always going to get those optimized results as well, because they're kind of from the same family. Okay, perfect. I hope it's helped tonight, guys. I really hope you've enjoyed it. I certainly need a coffee after this. I really do enjoy doing these, and it's so great when I get all the questions. I really do love it, because it tests my knowledge as well. I'm like, hang on, let me think, and then Annette can't think of some words, so that just shows that I'm human. But yeah, the product is great. The product, is something that I use every day. It's probably one of the most used peels that I use in my clinic. So I'll pop my email there if anyone does have any questions. It is one of the most popular treatments that I use in my clinic. And again, you need to cost it accordingly though. So per peel, you need to work out the cost per peel. You get around about 3 to 4 peels out of one vial. And in order to get, I think there's an offer on them at the moment, do have a look on the Shop Beautiful website. You're getting 5 vials in a pack as well. So yeah, just cost it accordingly. Don't underprice yourselves. This is a really good peel, a good all-rounder. Remember that salicylic allergy that we need to avoid. And yeah, just see how you get on with it, guys. But if you don't have any peel training, I would advise you that you have that first before you just go into offering this. And if you're not confident in the application of, then you shouldn't be applying it to that patient's skin, and seek some advice accordingly. There is a community that I posted on this morning, which is how some of you guys have found this webinar. I do weekly webinars with Shop Beautiful. I'm doing one this week, and we've been doing them every week on the skin. So we've done a skin science series. So do check that out. It's on a Wednesday at 7 o'clock, but there are the old ones that you can rewatch. If you look on the Shop Beautiful YouTube and/or previous webinar list, you will see. So my advice would always be to start with skin, start with the foundation. So some of these questions that you have asked, it would be helpful to watch these webinars back. I promise you will find them helpful. But yeah, I hope you've enjoyed it, and any questions that you do have that I haven't answered, then please do drop me a line. I'd love to hear from you. And yeah, oh, it was just messages. Yeah, thank you. That's great. Thank you. Thank you. Thank you. Someone's asked about putting it in the fridge. In this weather, yes, when it's a bit warm and muggy, but ultimately no, because it has that stabilizing lipophilic layer on top as well. All right, guys, have a lovely evening. I am sorry if you could hear any background noise and if it was a little bit disjointed this evening. I was a bit of a stand-in for this. I did know about it a few weeks ago, but I'm a stand-in for this webinar. But I love BioRePeel. I love talking about it. And yeah, hopefully I'll see more of you soon and on my other webinars. Thank you, guys. Take care. All the best and have a lovely evening. Bye.